Thomas was once a skilled carpenter. Thanks to the appreciation of a professor, he was invited to work as a lab assistant microscope. They began exploring a treatment for what was then called blue baby syndrome. Thomas put forward a bold suggestion, using an artificial tube to deliver more blood into the lungs. The idea was to increase blood flow to the lungs, which could improve oxygen levels. They started with animal trials. Using his own unique stitching technique, Thomas carefully repaired the blood vessels of a puppy. Encouraged by the results, the professor spoke to the parents of an infant patient, saying they might have found a possible treatment. But soon after, the puppy's recovery didn't last, leaving both Thomas and the professor deeply discouraged. The next day, Thomas realized what had gone wrong. He told the professor about a dream he had, where a grown woman spoke with the voice of a baby. This inspired the professor to understand. As a baby grows, the sutures on blood vessels may loosen, leading to complications. So, they decided to let part of the vessel heal naturally while securing the rest with stitches. Before long, they were ready to try the new procedure. In front of many medical doctors, Thomas himself performed the experimental stitching method, while the professor, despite his high position, stood by as his assistant. The tension in the room was overwhelming, but the trial succeeded. Meanwhile, the infant patient's condition grew critical, and surgery could no longer be delayed. Under enormous pressure, the professor prepared for the operation. It was an unprecedented procedure, attracting many of the medical field's top names to witness it. Yet when the surgery was about to begin, Thomas was nowhere to be found. This made the professor visibly uneasy. He demanded that Thomas be brought in, despite strict hospital rules allowing only licensed doctors inside the operating room. Ignoring the objections,
Agent Vivian Thomas.
She wanted it in OR right now. Come on the run, you hear?
This is Blaylock.
to the surprise of everyone present, Thomas entered the room. With Thomas assisting, the professor was finally able to operate with steady hands. As the baby's blood pressure dropped to a dangerous low, the professor asked for a special tool, a vessel clamp that Thomas had crafted himself. Guided by Thomas, the professor used the innovative stitching method to control the situation. The surgery was finally completed. Slowly, the infant's color began to return to normal. This marked the world's very first successful open-heart surgery. But when celebrations and interviews followed, the one person who had contributed the most, Thomas, was left unrecognized.